My next guest, Karen, spent 13 years addicted to 8 different prescription medications, and no one knew this school teacher secret. She says she started taking the meds for pain. Karen says it took an overdose, 4 days in a coma, and a family intervention before she finally got help.
I have been through a lot in 59 years. In April of 2002, I was diagnosed with multiple sclerosis. As the MS progressed, to deal with my pain, my doctor first started giving me Vicodin. That was followed by Demerol, OxyContin, morphine, Dilaudid, paired with Valium, Xanax, and Ambien. The more I complained about the pain, the more my doctor kept giving me meds. When the pain didn't get better, I turned to the alcohol as a way to increase the numbness. The meds affected my life so much that I fell asleep during conversations. I even fell asleep at a close friend's funeral. I only left the house to go to the doctor to get my prescription, to the pharmacy, and to get my nails done. I overdosed in March of 2015 in Las Vegas. That was when I hit rock bottom.
Well, joining me are Karen and Dr. Harry Tooney. Now, Dr. Harry is a board-certified addiction medicine expert and the author of the AARP book, Not as Prescribed. So thank you both for being here. So, when all this was happening, did you ever feel like you were an addict?
Absolutely not. I was diagnosed with MS, and I had a lot of pain. So I started taking the meds and then started drinking on top of it to increase the numbness from the emotional and physical pain.
Right, but you were balancing a lot of things. You were a mother, you were teaching. That's a lot going on in your life.
When I was diagnosed with the MS, I quit working.
Is that when you pulled back?
That's when I isolated and pulled back from family events.
So, Dr. Harry, how big a problem is prescription drug misuse among people over 50?
Well, it's a huge problem. 17% of people over 50 will eventually show the signs of addiction at this state. It's highly unrecognized. By the year 2020, we expect 10 million people in that age group to be addicted.
Why is this such a huge problem for seniors?
Drug misuse, alcoholism, and polypharmacy. Some of these people are coming in to treat with 10 to 20 medications prescribed by 4 or 5 different doctors who never speak to each other. Mixed with alcohol, the combination can be lethal.
Dr. Harry, how can family members tell if a loved one is showing signs of age, just decaying cognitively or physically, or if it's a medication addiction problem? How do they differentiate the two?
Unfortunately, most of the characteristics of aging overlap with polypharmacy and the side effects and so forth.
You talk about some of the differences in your book, Not as Prescribed, right?
Yes, we do.
If a person, for example, is becoming more forgetful, that could be a sign of dementia. But if you know that they take several medications, it could be that as well.
Absolutely. Some of the more simple medications which can really affect the memory, their lack of activity or engaging with family, so it's difficult to tell.
So, Karen, after 13 years of addiction, you've been clean and sober now for almost 2 years. How do you manage the MS pain?
I practice a spiritual 12-step program, and I meditate and practice Qigong. I feel like I have a brand new life. It's just incredible.
Well, keep up the good work on that. And if you're worried about an elderly loved one who may be addicted to prescription meds, I really urge you to go to aarp.org/health, because there is a whole section of dealing with prescription drug abuse among seniors and a whole lot more. And trust me, this is a great website. Dr. Harry mentioned his AARP book, Not as Prescribed. It is a must-read for anyone who may have concerns about a family member. And everyone in the audience is going home with a copy. So I'm going to send everybody home with a copy. And Whether it's for you or a loved one, it is worth a read because we've all got family members in that situation. So we just need to know what to look for. So I want to thank all of my guests today, and a special thanks to AARP and Dr. Harry. We'll